Hello everyone, Professor Miller and Susie. Susie is going to be taking us on a trip through the anatomy of the body. Today we're going to talk about pulse and how we measure a patient's pulse. So let's go ahead and take a look inside of Susie. As you notice, you can see the organs. You can see the heart located in the middle of the chest, located right under the breastbone or the sternum. For those of you who are CPR certified, this is where you go ahead and actually put your hand on the breastbone. And you can see you will be actually compressing on the heart. This will produce blood flow to the brain for our patient. We're going to be assessing the pulse, and when we go ahead and assess the pulse, we are going to evaluate it for its rate, the strength, and the regularity. This is going to tell us how well the pump is working, or the heart muscle, and if there is enough fluid in the body or too much fluid, that we can determine what the pulse's characteristics are. So we're going to take a few minutes, and I want you to write down what you think is considered a normal rate, rhythm, and what you think it should feel like when you place your fingers on the pulse, and what the abnormalities might be as well. So we'll take a few minutes and jot those down, and we will be back shortly. Okay, so where are we going to locate pulses in our patient? The first one we're going to talk about is we have them in the temple. And many times you will find that baseball players in the past were hit on the side of the head. And if they were, they're likely hit on their temporal artery. That is why we see the shields on the side of the face to prevent that from happening. Because when they were hit in the head, in the temporal artery, it caused a possible brain injury, and it was detrimental and very potentially life-threatening for that person. The next pulse we're going to look at is the carotid artery, which is located in the neck. You notice that it is red, and that means it is carrying blood that has oxygen in it. This is taking oxygen as well as food into the brain. And after we have the exchange of oxygen and carbon dioxide, we see it comes back as a blue color through the jugular veins. When I go ahead and assess the carotid pulse, I'm going to take 2 fingers and place it right in the little groove next to the Adam's apple, and I'm going to apply slight pressure. And I should be able to feel the pulse. When we assess our pulses, we usually assess them for a minute so that we can determine regularity and strength of our pulses. The next pulse we can assess is the brachial, which is located in the upper arm. If you take your fingers and push up against your humerus, you will go ahead and apply some pressure there, and you can feel the pulse. This is the pulse that we occlude when we go ahead and assess your blood pressure. Our radial pulse is located on the thumb side of the arm, and again, we have a ridge that we will follow to the dip and use our fingers and apply pressure to feel the pulse. Do not use your thumb, as your thumb has its own pulse. So the radial pulse is the easiest to find, so we'll have you go ahead and check your pulse later and determine the rate, the regularity, and the strength. We can also do the femoral pulses located in the groin. We have pulses behind the knee called the popliteal. We also have a pulse behind the ankle, which is the posterior tibial. And we also have a pulse right below the big toe, and that is called the dorsalis pedis. You will notice that we have what we call an electrocardiogram, or EKG, here on our patient's abdomen. We're going to go ahead and take the skeleton off so that you can better see the heart muscle. As you see, the EKG complexes, we have a very large complex, a very tall line. That tall line is representing the ventricle contracting here in Susie's heart. So we can see that it's nice and regular, and it is beating very regularly. So what does it look like when our patient's heart is not beating very effectively? This is what we call fibrillation, and our ventricles are not pumping appropriately. So we have a quivering in the chest. So the way we fix this is with electricity. And what we have over here is an AED, or an automated external defibrillator. These are the pads that we are going to go ahead and apply to our patient's chest. You notice that it shows you exactly where to apply these pads. You will find these AEDs in airports, some schools have them, and you may also find them at large public arenas. So we'll go ahead and place our pads on our patient's chest. And when we're ready, we go ahead and defibrillate. Now, the amount of energy we use is anywhere from 200 joules to 360 joules. So that means you have to make sure you're not touching the patient or anything that the patient may be on or touching, because if they get that energy, so will you. So you want to make sure that you or anybody else is not touching that patient. So when we are ready to defibrillate, we will go ahead and defibrillate our patient. And one of two things can happen. One, we lose pulse totally, or it will come back. And then we will go ahead and assess a pulse to make sure that we have a regular rhythm, what the rate is, and also the strength of it. So this is our pulse assessment. If you have any questions, please feel free to email them to Mr. Dorsey, and he will forward them on to me. Thank you for your attention today, and I look forward to our next meeting.